My name's Dr. Gregory Jones. I'm an obstetrician and gynecologist at Jackson Hospital. I'm married to a wonderful wife, Emily. She's fantastic. I have 5 children, Madeline, Owen, Isabella, Emmy, and baby Ben. I have become a beekeeper since I've been in Montgomery, and I wanted 1 or 2 hives, and somehow that's grown into probably 15 hives. But I enjoy beekeeping and spending time with my family and children. I like to tell people about choosing a residency. It basically chose me. In short, I decided that it was the only thing that I really liked when I was doing my rotations. I originally wanted to do trauma surgery, and I pointed myself in that direction very early. And I remember doing a rotation at the old Charity Hospital in New Orleans before Katrina, and it was not a good experience. It was just not what I wanted to do for the rest of my life, certainly. And I did a lot of soul searching, and I had gone on a rural rotation in Elk City, Oklahoma, and worked with a primary care doctor, a family practitioner who did a tremendous number of deliveries, and I had a great time. So I went back to that small town. I did another month and delivered babies with him and enjoyed that experience. In the School of Public Health, there's several disciplines that you can select, and one is epidemiology. So it's the study of disease, but as it affects a population. So in a sense, it could be considered an applied statistics degree. Much of my work at Jackson, it focuses in the GYN section of that world, pelvic reconstruction for pelvic prolapse, disease of the reproductive system. You have infertility and endocrinology, also GYN oncology. Certainly we don't offer that product line at Jackson Hospital, but you're on the front line of receiving those patients, diagnosis, initial treatment, and many times follow-up for those GYN oncology patients. If I could pick one general goal for all patients, it's usually quality of life improvement. You want to improve the quality of life for all of your patients, be that delivering a baby and allowing that baby to come out in a healthy way and growing that family, or improvement in a prolapse that a patient may have or a gynecologic condition that they may have, pain improvement. But I suppose it's always improvement in the quality of life for all of your patients. One thing that I liked about obstetrics and gynecology very early on is one of the few places in the hospital where patients leave happy. You make a family. You always have a great feeling at the end of the day when you receive that smile. There's not always happiness leaving and coming, but many times there is, and that's a terrific feeling. Jackson is fantastic. Jackson represents a terrific medical network of physicians that collaborate very well together, and they treat not only their patients, but the physicians that work there like family. And it still practices much like the hospitals did many years ago, where you still have strong physician respect, patient respect, and I've enjoyed it.